USMLE type question, Escherichia coli, pneumonia, and neonatal meningitis. A 3-day-old male infant is brought to the emergency department with respiratory distress and poor feeding. The infant was born at term via normal vaginal delivery. On examination, the baby is febrile, 38.5 degrees Celsius, has tachypnea, and exhibits grunting. Blood cultures and cerebrospinal fluid (CSF) analysis reveal gram-negative rods that are lactose fermenting. The most likely pathogen is identified as Escherichia coli, E. coli. Which of the following virulence factors is most important for E. coli's ability to cause neonatal meningitis and pneumonia in this infant? A. Capsular K1 antigen. B. Endotoxin LPSC. P. Fimbria. D. Shiga-like toxin. High E. urease production. Answer and explanation. The correct answer is A. Capsular K1 antigen. Key clues for USMLE thinking. Respiratory distress, poor feeding, tachypnea, and fever suggest sepsis or infection, possibly neonatal pneumonia. Gram-negative rods, lactose fermenting, suggests E. coli, a common cause of neonatal infections. Cerebrospinal fluid (CSF) analysis revealing gram-negative rods points to neonatal meningitis. Lactose fermenting suggests E. coli, which is lactose fermenting and gram-negative. Why capsular K1 antigen? The K1 capsule is a virulence factor for E. coli, particularly in neonatal meningitis. The K1 antigen helps E. coli evade the immune system by inhibiting phagocytosis and complement activation, which allows the bacteria to cross the blood-brain barrier and infect the central nervous system, CNS. Capsular K1 antigen is also critical for causing neonatal pneumonia in this vulnerable population. Why not the other options? B. Endotoxin LPS. E. coli's LPS triggers systemic inflammatory responses and septic shock, but is not as important for crossing the blood-brain barrier. C. P. Fimbria. Important for urinary tract infections, not typically for meningitis or pneumonia. D. Shiga-like toxin, seen in enterohemorrhagic E. coli, EHEC, causing hemolytic uremic syndrome, HUS, not relevant to neonatal meningitis or pneumonia. E. Urease production, seen in Proteus species, not E. coli. Urease helps in alkalinizing urine, contributing to struvite stones in UTIs. Would you like another question?